We're going to go over foot anatomy, focusing essentially on the plantar aspect of the foot, although in this initial images we're seeing the dorsal aspect of the foot. Here we are again going to the plantar aspect, where you can see the three bands of the plantar fascia, which are the central, the lateral, and medial bands. Also, you can know some of the vasculature, the medial and lateral plantar arteries and veins and nerves as well on the medial aspect of the ankle. Now remove the plantar fascia, we can see the flexor digitorum brevis muscle, which is the main muscle underneath the plantar fascia. With that muscle removed, you can see the quadratus plantae muscle, as well as the abductor digitorum minimi muscle as well, which is essentially at the same level as the flexor digitorum brevis. Now we're removing the quadratus plantae muscle. You can see the long plantar ligament underneath that. Appreciate the complicated musculature on the plantar aspect of the midfoot going into the forefoot. You can see all the different lubrical muscles, which are essentially attached to the tendons of the flexor digitorum longus muscle. You can appreciate the adductor hallucis muscle with the oblique and transverse heads. And also you can appreciate the deep plantar arch. Here's a good view of peroneus longus tendon as it wraps around from the lateral aspect of the foot and going medially to insert at the base of the first metatarsal in the medial cuneiform. Here again is a good view of that peroneus longus tendon, again with the deep plantar arch and the adductor hallucis muscle. Now we're bringing back the flexor digitorum longus and bringing back some of the other musculature on the foot. And here's flexor digitorum brevis. And now here is normal plantar fascia. So this patient has plantar fasciitis, pretty much moderate towards the origin of the plantar fascia, which you can appreciate here, labeled number 1. You see how it's erythematous, thickened, somewhat boggy. And this is where most people get tender when they have plantar fasciitis.